And then hepatitis B is sexually transmitted. There's no reason to give a baby that's almost just born hepatitis B. So I would say wait till the baby is 12 years old and formed and take hepatitis B. And I think if you do those things, it's going to be a whole different, it's going to be a revolution in a positive sense in the country.
I'm doing my sigh again.
I mean, that calls for a laugh. It really does, coming from medical people. So the president of the United States, that's y'all's president. That's, anyway, speaking wrongly, so wrong about hepatitis B transmission and why babies should not be vaccinated at birth, waiting until they're 12 years old. What? Get out of here with that nonsense. Today, we are talking about public health, political theater, and very real consequences when ideology outweighs evidence. So yes, all of this happened this week. So let's do the rundown one theme at a time. You know, the leadership has failed us and the fallout is now hitting who? Americans first. I'm Dr. Sloan.
I'm Dr. Brown, and we are AYA, Black and Brown Women Disruptors in Healthcare and Beyond. So the Federal Advisory Committee on Immunization Practices, ACIP, dropped a different kind of bomb this week. So they met to discuss whether to scale back infant vaccinations for Hep B, and the meeting quickly spiraled into controversy that you could see coming from way far away. What did we see? Racial innuendo, anti-vaccine rhetoric, committee members handpicked not for expertise, but for ideology, and ultimately a decision to delay the vote because the members said they didn't have enough time to look over the wording. But ultimately, let me just translate this for you. They weren't prepared, they weren't aligned with the science, and they weren't functioning as a scientific advisory board that they were built to be. Meanwhile, Hep B, hepatitis B, kills over 1.1 million people worldwide every year and has been one of the biggest success stories of infant vaccination. So scaling that back is not a minor tweak in policy, it's a seismic shift in preventative medicine. So scientists are calling out the committee yet again. Former CDC officials are even calling it a dangerous drift away from evidence. And we have drifted far, far away from evidence since January 20th. So pediatricians are bracing for what this could mean in practice. We should not have to wonder whether the nation's top immunization advisory group, right, ACIP, whether they're going to recommend things that we already have the science for, right? We shouldn't have to wonder if they're going to be using Google to figure out what they're going to recommend or some ideology to recommend vaccine policy. So this committee, it used to be an international gold standard, and now experts are scrambling to remind the public not to trust an advisory body that no longer resembles one. So I want to just talk a little bit about Hep B and how it spreads, especially in kids. So kids get hepatitis B. It's usually it can be passed from the mother to the infant during delivery, or there's close household contacts through razors or toothbrushes or nail clippers, so blood or other fluids. And even exposure to blood through minor cuts or nosebleeds, or even if your kid's playing and then gets bitten by another kid, they can get Hep B, okay? Unsterile procedures, tattoos, piercings, you can get Hep B. How Hep B is not spread? Hugging, kissing, sharing food, coughing, and breastfeeding after vaccination. So prevention is key, right? Vaccination, the Hep B vaccine series, the first doses at birth, is highly effective. You want screening, so all pregnant women should be screened for Hep B. And then hygiene, you want to avoid sharing personal items. So, the president's wrong again. Babies can contract hepatitis B, and they are not protected simply because they're not sexually active, which is ludicrous, right? And I really find that this selection of the age 12 as a cutoff point is a little interesting and pretty curious. So it seems to be possibly related to this unfiltered Epstein file. That's one of the ages of the girls that's mentioned. But meanwhile, we have another measles outbreak to deal with, another preventable failure. Let's roll the clip.
And a Fox Carolina safety alert you need to know tonight. State health officials are now giving some new information after they reported 27 new cases of measles right here in the upstate. The total number of cases related to the outbreak is now 111. There are a total of 114 cases in South Carolina this year. Right now, 254 people are in quarantine and 16 are in isolation. Officials say holiday travel could continue to spread the infection, so make sure you're aware of how many people you could be around.
I mean, this is supposed to be one of the biggest holiday travel seasons since like COVID. So in South Carolina this week, health officials have now placed more than 250 people under quarantine, isolation, after a confirmed measles case at an elementary school. 16 individuals have already been in isolation, and usually isolation is 21 days. So let's be unmistakably clear here. Measles is one of the most contagious viruses on the earth. You can enter a room, and 2 hours after that infected person's left, you can still contract measles. So this outbreak didn't just happen overnight, you guys. It's the predictable consequence after declining vaccination rates that didn't have to fall because measles has become less dangerous? No, but because public health messaging has been politicized and weaponized, and it's been turned into this cultural battleground between red and blue, if you will. But nationwide, measles cases are climbing, you guys. CDC reports 84 new cases just this past week alone, and the highest weekly count since April. So Texas, remember the major outbreak that we started the year off with talking about? That major outbreak may have ended in August, but the virus didn't stop. And now it's accelerating in different regions like South Carolina. There's a new rapid spread, and some of the residents there have been quarantined for a second time because they still lack protection. So either through vaccination or natural immunity after previous exposure, you can be immune to this thing. But if not, and you're an anti-vaxxer, then you are highly susceptible. So state epidemiologist Dr. Linda Bell warned everyone on Wednesday that now with each new case, it's under people that are under vaccinated or their communities under vaccinated, expands this circle of risk, creating potential for exponential growth, which is what we're watching. The fallout is immediate. Children are going to be pulled out of classrooms. Families are forced to isolate 21 days. Hospitals are now heightened with their alerts when people come in. Face masks are needing to be used again. And communities that are facing a disease that we eliminated, decades ago. So here we are. And now, just in, South Carolina isn't the only problem. There's also Utah and Arizona. And cross-border outbreaks have been smoldering for months in Canada. So also Arizona, remember there was 176 cases and Texas was number 2, while now Utah is reporting 115 cases. It is, by every measure, a historic year for the measles. And January to July, we had over 1,300 cases. That's crazy. That is something unheard of if we eliminated this disease 25 years ago, so to speak, right? So the message to the public health leaders is very blunt. The only way to stop this rapid rise is vaccinations, people. So public health becomes political theater instead of evidence-based practice. The cost fails our children's, our families, our schools, our communities, right? And so our community has trusted these systems. Now they're gone. They have disappeared. They have failed. And we are now starting to pay the price. And our youth, our kids are starting to pay the price. So according to the latest CDC, I don't know if we can trust them, but their data says 1,900 measles cases this year. And we still have 2 weeks left in the year. It's the highest count in decades. And the pattern's been very clear, crystal clear. The vast majority of these people are who? Unvaccinated people. So public health experts are raising the alarm for another reason also, because if these outbreaks continue into January 2026, the United States will be at risk of losing its measles elimination status, which was declared again 25 years ago. So that status doesn't mean 0 cases. It means we've prevented continuous year-long spread. But with multiple outbreaks, Dr. Brown, still active and vaccinations rates are slipping, the safety line is getting thinner and thinner by each week. Let's roll this clip.
His relentless fight to make America healthy again is really triggering the left. One House Democrat filing articles of impeachment against RFK Jr. today. Haley Stevens from Michigan.
RFK Jr. has turned his back on science, on public health, and on the American people. Under his watch, families are less safe, healthcare costs are skyrocketing, and life-saving research, including right here in Michigan, is being gutted. RFK Jr. is the biggest self-created threat to our health and safety.
Yeah, he's the biggest threat we've seen in a long time. And like she said, it's not just Michigan, it's all over the country right now, Dr. Brown.
Yeah, and the fallout doesn't end there, right? So inside the Department of Health and Human Services, senior officials are also recommending impeachment proceedings against HHS Secretary RFK Jr. This is not routine. This is not partisan noise. This is a federal workforce saying the public cannot be protected under this leadership. And the list of concerns is serious. Fired all 17 federal vaccine advisors. Installed anti-science loyalists. Pressured CDC leaders to modify recommendations, kicked out scientists who resisted, and oversaw a growing collapse of public trust during multiple outbreaks. So we've lived through this type of leadership vacuum before. And the last time public health was destabilized at the federal level, hundreds of thousands of Americans died. The call for impeachment's not symbolic, it's survival. Public health cannot function when the top job is held by someone who's fundamentally against the system that they are responsible for protecting. And then, of course, just in, more breaking news, while preventable diseases surge and our federal agencies are destabilized, the U.S. Senate just voted against both the Democratic and Republican proposals to extend Affordable Care Act subsidies. And this extension was a promise that was made when the government reopened last month. And that was a deal that Senator Schumer agreed to pursue. And now both plans have failed. So what does this look like for everyday Americans? Millions of families who rely on these subsidies now face a very steep cliff. In January, premiums could jump by hundreds of dollars a month. And some people will be forced to drop their coverage altogether. And this is happening as Medicaid is unwinding, right? Medicaid's unwinding, and that already pushed millions into these ACA plans. There's preventative care and screenings that depend on affordable coverage, which will be lost. And of course, as we keep discussing, we have these outbreaks, measles, whooping cough, flu, any of these diseases that we've talked about so far. And these are active and surging in multiple states. So this is not a budgeting issue. It's a political decision with real world consequences for working families in the middle of a public health crisis. So when leadership fails to make this commitment to protect the healthcare and to protect access to healthcare with those shutdown negotiations, and then it takes that commitment back, it's a problem. It's creating instability, and it's crisis management by improvisation. And Americans, the most vulnerable Americans, feel that instability first. So our through line, allowing ACA subsidies to lapse does not happen in a vacuum. It hits the same families that are already carrying the weight of rising infections, strained hospitals, unaffordable premiums, and disrupted care. And the fallout lands harshest on the communities with the fewest buffers. So here at AYA, we will continue to report on what is happening clearly, factually, and without looking away.
Thank you for watching. Stay empowered, stay disruptive, get your vaccines, and remember, your voice does matter. We're AYA, contributors to MeidasTouch Network and proud members of the Meidas Mighty. Please subscribe, like, share, and comment, follow for more information. Have a happy holiday season. Thank you, guys.
Happy holidays, everyone.
Want to stay plugged in? Become a subscriber to our Substack at MeidasPlus.com. You'll get daily recaps from Ron Filipkowski, ad-free episodes of our podcast, and more exclusive content only available at MeidasPlus.com.